I think there's been three big changes that have happened in the health research environment in Canada in the last 5 years or so. One has been a much bigger focus on the many types of research that make a difference. So in Canada, we now talk about 4 pillars. We talk about basic or biomedical research, we talk about clinical research, we talk about health services and policy research, and finally population and public health. I think historically in Canada the focus was more basic biomedical and clinical, and the talk of pillars has really made it clear that we need all 4 types of research. Second big change, I think, has been a move to interdisciplinary research, a lot more focus on us trying to cut across disciplines and work at the interface between disciplines. And I guess the third change has been a transition from a focus on research to a focus on research that might have applications many years in the future, but also trying to figure out how do we harness that research. So the short way of saying that is we're now focused on research and research use, and that's been a really big change. I guess I'd like to see 3 big changes happen in the research landscape, especially in Canada, but I think this is true of many other countries in the Americas. First, I think a greater emphasis on the synthesis of existing research, and I'm thinking of 2 types of synthesis, both systematic reviews, say of the type done by the Cochrane collaboration that answer a very specific question, and then also evidence briefs that instead of starting with the research interests of us, we start with the policy issue that's really at the forefront of policymakers and managers' mind, and then work backwards to find all the relevant evidence about the problem, about options for addressing it and implementation considerations. And we call those evidence briefs. I think we need both systematic reviews and evidence briefs. Second thing I'd like to see more of is more of a focus on giving attention as well to the tacit knowledge that people have about how things actually work and their real-world views and experiences. So we say, look, we can bring the evidence to the table, but we also need this tacit knowledge and real-world views and experiences. And I think deliberative dialogues have that potential to do that. So some people call them policy dialogues. We tend to call them stakeholder dialogues. But the idea is bringing people together with a shared interest in a topic, informed by the evidence, but also giving attention to these other factors. I think the third thing that I'd like to see is an improvement in the climate for research use. I think we've seen a small number of countries or provinces or states where strong signals have come from the top, from the minister or the top civil servant, that using research evidence is a core part of doing a good job in government. We've seen people change performance criteria, so people working in those environments have to make better use of research evidence in their work. And we've seen training that goes along with it so that people have the skills to do it. And we've even seen innovations where people have to now document how they found and used evidence before they bring something up to the minister or to cabinet. And that's really transformed the climate. So I think if we could move forward in those 3 domains, greater focus on synthesis, greater attention to tacit knowledge and real-world views and experiences through things like dialogues, and then finally that improvement of the climate, strong signals that research use matters.